As the Chief Executive Officer of a thriving emergency room business, I saw some shocking things about your employees that you need to know, especially the ones with a group health insurance card in their pocket. Now, if you are currently paying for group health insurance for your employees, or even thinking about health benefits for your people, then this video is required watching. In today's episode, I'm pulling back the ER privacy screen in order to help business owners like you provide better employee health benefits that employees love for a lot less money than high deductible health insurance. But first, welcome to the Art of Business. Hi, I'm Art Goetze. Now, I've bought and sold all kinds of businesses, including the first freestanding emergency centers in the nation. I also started a Fortune 500 company at the kitchen table with a couple of my friends. We acquired and integrated and operated over 200 businesses with more than 35,000 employees. So you can't imagine all the things I've seen and the problems we solved. So I decided to start this channel to pay it forward by helping other business owners like you. What is your business struggling with? Write me a note in the comments and I'll give you my best advice for free. All I ask in return is that you like and subscribe to this channel, The Art of Business, and I'll do my best to keep it interesting, informative, and insightful. Now, I'll be the first to admit that I was just a dumb business guy running emergency rooms with doctors and nurses, CT scanners, and x-rays. But the fact was that I was an outsider, and it gave me a unique perspective on the business of healthcare. For example, everyone called the people who came to our facility patients. So I came up with a tagline about treating the customer in every patient. Now, what shocked me the most was that nearly 85% of our customers were actually not emergencies at all. It turns out that they were just misplaced primary, preventative, or urgent care. They just came for the convenience of a $250 copay. All they knew was that the kid had a crayon up his nose and a trip to the ER only cost $250 because it said so right on the back of the Blue Cross card. What they didn't know was that their employer was actually footing the rest of the bill in next year's premiums. They also didn't know that 6 to 9 months down the road, the ER visit could be denied by Blue Cross, leaving them, the employee, on the hook for the entire bill. My next big ER awakening was that darn near 100% of the people who came to the ER were actually there needing the very same thing. It's called triage in the business. They just needed a medical professional to size up their situation, render a diagnosis, and recommend a treatment plan. Whether it's a prescription, stitches, or a referral to a specialist, all healthcare episodes start with triage. In the ER, I learned that scrubs or a white lab coat is all that most people need to actually trust a doctor or a nurse. And because people are out of their comfort zone in the ER, they don't know what they don't know. And they don't ask about the cost, and they don't ask for the doctor's resume before getting the triage that they need. That's because health insurance has eliminated customers from healthcare. Where customers normally decide based on price and quality, with health insurance, employees are taught to just trust the insurance company to negotiate the prices and to pick the best doctors. You see how this scam works? They control where you go for care, they negotiate the price of care, and then they set the premiums that employers have to pay for it. So what's your problem, right? All you wanted to do was comply with the ACA rules, help your employees stay healthy, and a little health benefits to keep them on the payroll would be nice. So why don't you just shut up and buy more health insurance? But thanks to a recent change in the ACA rules, employers can now get off the health insurance bandwagon, and instead of blowing the entire benefits budget on group health insurance, employers can actually satisfy the ACA rules and invest in employees' everyday health care at the same time, and helping employees to be better consumers of health care by providing things like money for doctor's visits, gym memberships, and even subscription-based primary, preventative, and urgent care, all paid for using what's called the 401k of health benefits, also known as ICHRA, or the Individual Coverage HRA. And this seems like a great time to thank our sponsor, Scoop Health, where great employers go for great employee health benefits and where employers go to learn about the all-new ICHRA approach for employee health benefits. So check out our sponsor, scoophealth.com, for more information. So thanks for sticking around. I hope you enjoyed this episode. Please share it and subscribe to the channel. And remember, when the winds of change blow strongest, some hide behind walls while others build windmills.